Hello everyone, how's it going? Is your body low on potassium? Is there something that could put you at risk for being low on potassium? And if so, what would some of the symptoms be? And what does potassium do for our bodies anyway? If that sounds interesting to you, then keep watching. Now, low potassium is a condition called hypokalemia. I actually had a friend who was hospitalized recently. Her potassium was very low. So I did some research and found that potassium is not only a mineral, but it's also an electrolyte. And electrolytes conduct electrical impulses throughout the body. So it makes sense that if we're low on potassium, that if we continue to be low, it can actually lead to some serious health issues. Well, later on in the video, we're going to discuss when you might want to contact your doctor, when it would be serious enough to, and also we're going to talk about something interesting that potassium does, helps our body with. Something that surprised me, it was new to me. So potassium does a lot for our body. It actually assists us with blood pressure, normal water balance, muscle contractions, nerve impulses, digestion, heart rhythm, and pH balance. Now, our body does not produce potassium naturally. The best way for us to get potassium is through a healthy diet. Some rich sources are apricots, bananas, kiwi, oranges, pineapples, leafy greens, carrots, potatoes, lean meats, whole grains, beans, and nuts. You could also opt to try some fruit juice like prune, carrot, orange, and pomegranate. Just have to be careful with the juices because they can sometimes tend to be high in sugar. Seafood is a good option, such as salmon or tuna. Also, dairy products like milk and yogurt are good sources. You could also eat tomatoes or have tomato juice, and molasses is a good option as well. Well, how much potassium do we need? Well, it's recommended for women to take in 2,600 milligrams a day and men to take in 3,400 milligrams a day. But as we just mentioned in that list of foods, we have so many different options where we can get enough potassium each day. But we're going to talk about what might put some at risk for low potassium, what the symptoms may be, and when we might need to speak to our doctor. But before we move on to that, I'd like to remind you to please like and subscribe if you're enjoying today's information. Also, make sure you open up the description box below. You can check out the links there and find out where I had gathered the information for this video. And feel free to leave a comment if you have something interesting to share on this topic. Okay, so let's talk about those who would be most at risk. Well, anybody who's experienced prolonged diarrhea and vomiting. This could be due to illness, it could be due to excessive laxative use, or even someone with bulimia, which we know is an eating disorder. If you've experienced excessive sweating, if you have a magnesium or a folic acid deficiency, if you have kidney disease, even the use of some antibiotics can put you at more risk. If you have an inflammatory bowel disease like Crohn's disease, you're more prone to have the chronic diarrhea, which can cause you to lose a lot of that potassium. And overuse of diuretics or water pills is one of the most common reasons people wind up with a potassium deficiency. You could also, those excessive alcohol use or an adrenal disorder could put you more at risk. So let's talk about some of the symptoms now. If it's just a mild case, you may have no symptoms at all. But if it's something a little more serious, you may notice extreme fatigue, muscle cramps, weakness, constipation. The most concerning symptom would be abnormal heart rhythms. Now, potassium actually lessens the effects of sodium, so that's why it helps us with our blood pressure. It also helps ease tension in blood vessel walls, which further lowers blood pressure. So if you do wind up going to the doctor, most likely they'll want to check your blood pressure and possibly do some blood work. Now, if you are diagnosed with low potassium, it's possible your doctor may prescribe some kind of potassium supplement, but you never want to take one of these supplements without talking to your doctor first, especially if you have kidney disease, because you don't want to wind up getting too much potassium. That could cause a whole bunch of other issues. Now, if you have a severe case, they may want to give you potassium through an IV, especially if you're experiencing abnormal heartbeats. Now, most people just have a mild case, but if you're experiencing any of these symptoms we just discussed, you definitely want to reach out to your healthcare provider to find out what would be best for you to do. Now, this is so important to have the right amount of potassium in our body. It plays a significant role in the function of heart, kidneys, muscles, and nerves. So if we have low potassium, it actually could cause our blood pressure to raise up. It can increase our chances of having kidney stones, and can actually pull calcium from the bones, which actually is the thing that I found very surprising. I didn't realize what an effect it could have on our bones. Studies suggest that increased consumption of fruits and vegetables that have potassium in them is actually associated with an increased bone mineral density. That's something we really are concerned about more as we get older, especially women. Low potassium could also cause us some breathing problems. And this is because potassium is critical to the proper functioning of muscle cells. And when we breathe, it actually requires several muscles in the diaphragm in order for us to breathe. Now, for those with kidney disease, if they have low potassium, it actually could cause confusion. So we can see what an important electrolyte potassium really is, and we want to make sure we're getting enough. Hypokalemia is the most common electrolyte disturbance that's seen in a clinical setting. Most cases are actually mild, but if you're experiencing these symptoms like we mentioned before, especially abnormal heart rhythms, you definitely want to reach out for some medical advice to make sure that situation is resolved. Well, I hope you have enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.